Good evening, everyone. My name is Erin Mintzberg, and I'm the District Director for Congresswoman Lizzie Fletcher. Thank you all for joining us for tonight's community conversation on mental health. In a moment, we'll get started with introductions from each of our guests, after which we'll move into a Q&A period. For that, you can use the Q&A function that's at the bottom of your Zoom screen. So there's a Q&A box, and if you click on that, you can go ahead and put your question in there. After we get through the introductions, I will help moderate the Q&A, and I'll call folks out by first name and last initial, at which time you'll be able to unmute yourself and ask your question live. So again, that's the Q&A button at the bottom of your Zoom screen. All right, Congresswoman Lizzie Fletcher, I'll hand it over to you.
Great. Thank you so much, Erin. And thanks to everyone who's joining us tonight for this Zoom discussion, our virtual community conversation. This month and tonight, the topic is mental health, a topic that I'm excited to visit with you all about and with our panelists this evening, as well as to have an ongoing conversation about the work that we're seeing across our community and the work that we're doing here in Washington. But, you know, as we talk tonight, of course, I think we can all reflect on the many challenges that we have seen, certainly over the last 20 months, and the impact that COVID-19 and this pandemic has had on all of our lives. It's been a real shock to our system. It affects the way that we function and interact, and there's been so much that we have learned and we have seen as a result of this pandemic. And while it has presented us with a lot of new challenges, it has also provided an opportunity to see some of the existing areas, gaps in our healthcare system, including our mental health, and also I think an opportunity to discuss some issues around our mental health more openly. So, you know, since the pandemic began, more than 20 months ago, many people across our community have experienced isolation, stress, grief, or trauma. We have seen that, I think, each of us, all of us in our lives, whether it's the loss of loved ones or the associated traumas from the changes in our daily lives and the impacts on the people around us. And of course, unfortunately, we are no strangers to trauma. Most recently, we had a terrible trauma in our community with the events at the Astroworld Festival, leaving so many in our community just shocked and saddened and experiencing the psychological effects from having witnessed this tragedy unfold. And it's something that I've heard from people since I have been in office, as we've talked about some of the other tragedies we've experienced in our community, from Hurricane Harvey and the Tax Day flood and the Memorial Day flood and other storms and rain events that have really taken their toll on people across our community. The mental health impacts of those in our community is lasting. It's also evolving, and it has really left a lot of families, a lot of people struggling to understand what's happened, how to cope with grief and loss. And, you know, it's my understanding, I'm not an expert here, but it is my understanding that trauma changes the way that people see themselves and other people and the world, and that regaining a sense of safety can take days or months or years. And our panelists are here to talk tonight, and I'm really looking forward to hearing from them, share their wisdom. And I think it's important for all of us to understand that, you know, we sometimes think of trauma as kind of an acute incident, but an unexpected global pandemic that fundamentally alters the way that we work and go to school and socialize, and the incredible and I think for many of us just unimaginable death toll that we have seen in this country and around the world is also traumatic as it has unfolded over the last 20 months. I think this really is a moment for us to reflect on how our mental health is affected by environmental factors and to discuss how mental health diagnoses really can be impacted by them. Because the challenges that we've faced over the last year and in recent years, you know, they matter. And these issues don't just matter, you know, in a moment or an isolated period. It matters all the time. And what really matters is that we discuss it. openly using facts and talking to healthcare providers. And if we think of mental health as simply one part of our overall healthcare, just like cholesterol or allergies or diabetes or our vision, that's how we can and should think about it. And that's why I've worked in Congress to ensure that during the pandemic and beyond, that mental health resources are accessible and available. And I'm just going to mention briefly a couple of things that hopefully you all know. But in July, the House of Representatives passed a funding bill that included more than $9 billion for the Substance Abuse and Mental Health Services Administration, including $100 million for the National Child Traumatic Stress Initiative, more than $130 million for suicide prevention programs, and $5.5 billion for substance abuse and prevention treatment efforts. Those are programs that were supported and funded because of the experiences that my colleagues and I have seen across the country and know how important it is to fund this really important work. And then in September of this year, I introduced a bill working with folks from across our community. I introduced a bill that's called the Collaborate in an Orderly and Cohesive Manner Act. It's bipartisan legislation that invests in a delivery model that integrates behavioral health care within the primary care setting for the treatment of mental health and substance use disorders that require regular follow-up, like depression or anxiety and substance abuse. And so that's one of the ways that we can help more individuals get access to mental health care. And we know that more access to mental health care can improve lives and communities. So tonight, I want to provide a space to have your mental health questions answered. I know we've been hearing a lot about it from people calling our office, talking about what can we do in Congress to address real concerns across our community about the mental health of members across our community. And so, these questions can range, especially tonight, but, things we're hearing, can we address stigma? Where can we seek help? How mental health can impact you and those around you. And so I'm really excited that we have an incredible group that's joined us this evening for this conversation, and I want to turn it over to them. I'll introduce you very briefly to this really esteemed panel tonight. We have Dr. Andy Keller, who's President and CEO at the Meadows Mental Health Policy Institute, Angelina Hudson, the Interim Executive Director of the National Alliance on Mental Health of Greater Houston, and Wayne Young, Chief Executive Officer at the Harris Center in Houston. So each of these leaders brings a wealth of knowledge to our discussion, and I'm really grateful for their leadership on these issues in our community, in our state, and at the national level in thinking about how we address some of the challenges in front of us, and also for their partnership with me and my team and with all of us here tonight. So I thank you for joining us. I'm excited to hear from you, and I think we'll just go in that order. Maybe I'll turn to you, Dr. Keller, first for a few remarks and an introduction and sharing with folks who are participating a little bit more about you and your work. Thank you so much.
Great. Well, thank you, Congresswoman Fletcher, and thank you for your leadership on this. The two things you mentioned, I mean, that budget for SAMHSA, that's almost double what was being spent on the Substance Abuse and Mental Health Services Administration before the pandemic. And then the bill where, you're really putting those resources in primary care, bipartisan bill. I mean, you're not just providing more through that legislation, but you're really changing how we deliver care and trying to get it just like we made advances for heart disease and cancer. So I just really appreciate that. And I think too, the way you framed that, I mean, there are a lot of hard things, and I'm going to talk about that briefly, but I also think we're talking about this more. I think we are more open, and I think, one thing COVID did is it convinced us all that mental health is real and it affects all of us. So I'm a clinical psychologist, and I do a little bit of practice, but mostly what I do is lead the Meadows Mental Health Policy Institute, which is a nonpartisan, data-driven mental health policy and substance abuse treatment policy and program research institute. So we really basically try to help local, Texas, national leaders say if we want to help children or if we want to help reduce the number of people in the jail, what are the things that work, and then how do we implement those, pay for them, sustain them, partner with folks to make that happen. So that's what we do. And in Houston, we have a special set of operations through the Hackett Center for Mental Health. And the Hackett Center was really set up after Hurricane Harvey to respond specifically to the kinds of needs that the Houston community has. And we were really excited. Dr. Keonta Moore is our new executive director there, and she's a wonderful expert in early childhood mental health. And we also have a trauma and grief center there, which focuses on those types of services, which is, very much cut with what you're saying. And I do think, alongside trauma, grief has been something I think we've not paid explosive attention to, and it's something that's dramatically impacted us through COVID. And just a couple stats. 3.4 times as many Americans today are depressed than they were before the pandemic. About 22% of us, 1 in 5, are just depressed, and that's unparalleled. The number of young people, especially young women and young people of color, presenting in emergency rooms for suicide is double what it was before the pandemic. And the pandemic has been deeply inequitable, as we know, building on earlier inequities. So if you're a Black child, you are 50% more likely to have lost a parent to COVID. And we know that 4 times as many Hispanic Texans in the prime of life were lost to COVID than compared to other races and ethnicities. So we really need to grapple with the equity issues, but also with the grief issues. We need to really make sure that the treatment and care is available for those things. So that's a big thing we're working on, and I look forward to the discussion tonight to hopefully help folks think through some of those things.
Well, thanks so much, Dr. Keller, for that introduction. Lots of information there, lots of interesting things to talk more about. So I'm really glad that you're here. And also, Angelina Hudson, I'm thrilled that you are here. So maybe I'll turn to you next for your opening thoughts to get the conversation started. Thank you.
Well, I want to echo a big kudos and thanks to your work, Congresswoman Fletcher, because, without someone with your influence and attention and time to this matter, sometimes mental health, along with the stigma that's involved with it, kind of push this down and put it on the back burner, not only on people's minds, but also those dollars that we need freed up to serve the families and individuals that are facing these troubling challenges, which are cyclical, they're lifelong. So I represent NAMI. I'm serving as interim executive director, but I've been a part of NAMI for 20 years. And I champion, as the entire organization champions, for individuals and families who are actually dealing with the mental health diagnosis on a day-to-day basis. It's one thing to kind of talk about it in theory, but it's a completely different matter, when it's not about statistics that do not impact you, and those statistics represent what is really happening to you within your own home. So what our organization does, we partner with individuals and families that are looking for help. They want to know where to go. It is not one of the easiest illnesses or mental conditions to navigate within our systems of care, right? Number one, you're terrified. And you don't necessarily know that you're exactly dealing with a mental health challenge, because the behaviors can be elusive. One day a person can be just fine, and then the next day you don't understand what's happening. And so we are here to serve families and individuals who are looking for, what is the first step that I take? Who can I talk to? Where can I share this information? And then from that first moment that they know that there's a diagnosis or a real behavioral health challenge on board, we offer free psychoeducation courses, we offer support groups, and we walk the journey with those families and individuals. And we do this at no cost to the families that we serve. True advocates, of course, can always, write a check and do something to keep our doors open and help us activate more volunteers in our community. But it's the families that really are desperate for answers. They want to hear, where can they find a trusting guidance or trusting information that they can lean and depend on when facing these terrible challenges. And that is the work that NAMI does best, and that's why we're here. So thank you for the invitation.
Terrific. Well, thank you so much for being here and for the work you do. And you really just touched on something important when you just said that when families are in searching for information, to be able to find trusted sources and knowledgeable people, but also people who have empathy and understanding and can help them navigate a path, not just for a day or a week or a month, but really a partnership for the long term is so important. And I'd love to come back and circle back in our conversation about accessing those trusted sources of information. So really important point you touched on, and really excited to hear more of the conversation and more about what you do and what you think we should know, and families, maybe people who are participating or watching should know about how to go about that process. I think would be really helpful. But before we get to that, I would love to turn it over to Wayne Young for his introduction and introductory comments.
I knew I would do that. Thank you, Congresswoman. I appreciate it. And I appreciate your leadership in this conversation, the fact that we are talking about this and you're lending your voice and time and attention to this issue is critically important and extremely helpful. And bringing people like Dr. Keller and Angelina into this conversation, they're kind of the best of the best out there. You put together a really nice group, and I get to kind of ride on their coattails in this deal. But I am the CEO of the Harris Center for Mental Health and IDD. We are the local mental health authority and the safety net behavioral health system here for Harris County. We have about 2,400 dedicated team members who deliver care on an average basis to about 86,000 people a year here in Harris County. And we do that in 83 care locations across our community. And so we have a large impact, but I think we also know there's a large need. We have a lot of individuals in our community who need these resources and supports. And as you've referenced and my colleagues referenced, that's a growing need through the pandemic. We also have the good fortune or the opportunity to serve, I guess, really through operating Texas's statewide COVID-19 mental health support line. And so we have literally talked to thousands and thousands of people from across the state who've been impacted by this in large and small ways. And we've seen it kind of run the spectrum of individuals, people who never thought they would find themselves trying to reach out to a support line, typically didn't see themselves as particularly vulnerable. And as Dr. Keller mentioned, this is a shared experience we're all going through. And so we have seen that impact. We ourselves are serving about 20% more patients than we did just a couple of years ago. We answer the calls. If you are in Harris County and call the National Suicide Lifeline, those calls are answered by our trained crisis counselors, and we've seen about a 34% increase in those calls with individuals who are reaching out trying to receive support. And so we see that need every day, and we live it and try and meet those needs in our community. I will also express my appreciation for you mentioned the recovery funds that you and your colleagues worked so hard to bring into the community. And just so everybody's aware, those funds are reaching our community. We had an award from the county through the county funds that they had many millions of dollars to be able to help support community initiated care models, where we're going to develop skill building and resiliency in our community, all the way to very specialized programs from state funds that are coming through. So we're beginning to see the impact of the hard work that you did and the resources you brought to our community. And I'm excited about being able to expand the capacity to deliver care in our community because of that.
Terrific. Thanks so much, Wayne. I really appreciate the work you do for the people of Harris County. It's so important. And it's nice to hear that the resources that Congress has approved are making their way to you. I think that's one of the questions we get pretty consistently up here on all sorts of issues. And actually, I've been fielding a lot of questions because, of course, as hopefully you all know, the president signed the Infrastructure Investment and Jobs Act today. And the first set of questions I got from folks at home is, how are we going to make sure they get to Houston and Harris County? And so it's good to know that these COVID relief funds that Congress has appropriated have made it to you and have made it into our community. And that's been a real priority of the Congress. In fact, many of us have worked to get kind of direct allocation to our cities and counties like Houston and Harris County directly, because the need is so great and because time really is of the essence. And here, I think y'all have all touched on some really important issues. I have lots of questions for you, but I also know we have participants with questions. So I think what I'm going to do is, I've got a note from Erin that she has some questions. And I'd love, Erin, if you are ready to start with some of the questions from our participants. And hopefully we can get kind of each of your perspectives on some of these questions as they come through.
Absolutely. Yeah. So we have some great ones submitted. So I'm going to go ahead and read them out to you guys. And they're in no particular order. So the first question is from Amy K. What are we doing or can we do to ensure that mental health is appropriately handled in the work environment? Many have access to an EAP, but there are still perceived career consequences for taking stress leave or being open about mental illness.
Thanks. That's a great question, and I think it really is a good starting place. Who might want to take that first and share with us what you know about how these protections are being implemented kind of in a work environment?
I'm happy to talk about that one. I mean, we're part of an initiative called the Path Forward for Mental Health and Substance Abuse. Work closely with the Houston Business Coalition on Health here in the Houston area. Chris Kizak and the group, their conference is coming up in December. But what they really focused on is it's not enough to just do an EAP. It's not enough to just have workplace promotion. You actually have to give people health services. And these are private matters. And the problem is what we see is, you know, you can do all the stuff in the workplace. You could say, hey, you know, pay more attention to depression. Mental health is real. But then when you go and access your benefits and you have to call 10 different people before you can find somebody, and, you know, 3 of those people are like dead, but they're still somehow in your network or they've moved, that's a real problem. And businesses are stepping up on that. The Houston Business Coalition on Health is a real leader on that. And really, Congresswoman, you know, as you know, I love that bill on the collaborate in an orderly and cohesive manner. And that's the trick. I mean, we have to really get it in primary care. We can't wait till people are so stressed out and overwhelmed that they go to their EAP. So that's what businesses are doing, and we are seeing them doing it, which is, it's very exciting.
Well, that's great. Thank you. And yeah, I know I mentioned the Collaborate in an Orderly and Cohesive Manner Act in my opening remarks, but I do think it's important to say this is an existing care model that has had a lot of success, and that's part of why we are trying to facilitate it and make it something that's more accessible to folks, because we have seen that where there are fewer barriers, right, to getting access to those care providers, when it's a more direct route, you just have a greater likelihood of success with that connection. And so, you know, both eliminating challenges on the provider side to making sure that those primary care physicians have the resources they need, to making sure that the patients have immediate access to the care that they need. This has been a successful model, and that's why I introduced it with my colleague Jamie Herrera Butler. It is a bipartisan bill, and I think it's a good, you know, a good example of the kinds of things we can do together where there's a lot of bipartisan agreement, but also the kind of work that comes from people who live and work in our community who've talked about how important that is. So thank you very much for mentioning that particular bill. And I hear what you're saying about these challenges, and I do think it's important to know, you know, how we can eliminate some of those challenges people face in the workplace in terms of getting access to care. Angelina, you're nodding. You may have some additional thoughts to add.
I did, and it's a very you know, NAMI is a grassroots organization, so this is going to be a very grassroots response to Amy, and that is invite some of your community-based organizations to come and share with your EAP group, or even share with some of your executive leadership team, your middle managers, and do presentations on mental health interventions to your staff and employees. I know NAMI is invited all of the time to come and partner. We have a cadre of volunteers who share their story in a program called In Our Own Voice, and they actually represent every arena of industry, whether it's a lawyers association or the transit authority or oil and gas, nurses, doctors, it doesn't matter. We have speakers who are in recovery and have successfully passed through this journey of accessing help, you know, finding their recovery path, and they're willing to share that information with people who find themselves in the same predicament. So we do this for every type of business organization that there is, and we'd be happy to come to your organization as well.
Thank you. So the next question we have submitted is, are there mental health organizations for children? I feel there is a large need to address this early on to prevent complex trauma that may carry over into adulthood and become a generational issue.
There are several. So number one, I see NAMI Greater Houston as sort of a clearinghouse to help families navigate and find which organizations are going to help them best. But there are like 10, 12 organizations. If I start naming them, some will be angry, but but there are a lot of nonprofit organizations that are community-based that have been working for decades, specifically focused on children's mental health. And there's also clinics that are focused and have initiatives to do outreach for children's mental health, especially since the pandemic. So I would recommend, if you need those services, you could certainly give us a call on our warm line, and we will share exactly who in your community is serving from A to Z, different types of signs and symptoms or diagnoses themselves. And then B, if you are a person looking to volunteer and work in this arena, then look for the children mental health serving agencies that are there, and whether or not they're recruiting for volunteers and then willing to train them to do this important heavy lifting. It's going to take all of us, just like Dr. Kellis, it's all of us that are being impacted. And it's going to take a lot of advocates and volunteers and support from our community to set this right side up again.
Thanks, Angelina. Wayne, anything to add there?
Yeah, just the kind of additional thought that we certainly are a child and adolescent serving organization. There are many of them in Harris County that deliver high quality behavioral health services. I do think it's important often to start that conversation with your pediatrician. They often can provide the most insight. They know that child, they know where they're at developmentally, and can often help at least point people in the right direction, if not well connect them. At some point in this process, I'll certainly share our crisis line and our tech support line, because we also can help people kind of wayfind and navigate through the system. I also think that we've done a lot here in Texas to begin to think about how we might expand child and adolescent services. And here in Harris County, we have several organizations who deliver a lot of care through school-based partnerships and locations. And so I think that is a growing model that's critical to be able to provide supports where those youth often are and where they are comfortable engaging in care. And I think it requires less direct intervention from families. They're able to leverage that support in a more accessible, ready way. And I know Dr. Keller and his group had a lot to do with some of those increasing access to school-based services. So he probably would have a comment about that to share as well. But there are lots of points of access. And at the same time, there's not an adequate number of service providers either. So it's kind of a catch-22 in that.
If I could just add, the only thing I would add is that's another example of Congressman Fletcher where the American Rescue Plan Act dollars made a real difference. $113 million was just allocated in this last special session of ARPA funds for school-based supports like Wayne's talking about, and more supports in pediatrician offices through partners like the Harris Center, through Baylor College of Medicine, UT Health Houston, so and other medical schools statewide. So, without those funds, we would not be able to surge up, but we don't have enough providers, but the ones that are out there now have the resources to do a lot more than they did. So I think that's just an important thing for folks to know.
Thanks. One thing I know there are a bunch of questions. So I'm going to just put a pin in this, but maybe by the end we can talk about, or y'all can work in one of the other things about accessing care. Our earlier a participant asked about the EAP plans and accessing that. I know one of the things, a lot of those plans are kind of telephone based, and one of the things we worked on with the Rescue Plan Act and some of this COVID legislation and are continuing to discuss here in Congress is increased access for telehealth services. And so that might be something that would be useful to folks to know as we kind of go through some of the other questions. But that was another really important piece of the work that we're doing on our committee in thinking about not only making sure that we are providing more resources in various settings, but also that we're providing the ability to access telehealth services. So would love to get input from y'all on that. But Erin, I want to turn to the participants in the next question. And maybe y'all can share some of those thoughts as we go through more questions.
So we have a question from Diane M. I would be interested to know what doctors are noticing regarding issues that middle school students are currently experiencing, such as anxiety, depression, and suicidal ideation. Are there more cases now than in previous years? And are they COVID related or something else?
Well, I can share a little bit on that one. So unfortunately, there are more children affected. So, over the last decade, we've seen suicide rates, which is just one indicator, but, sort of the tip of the iceberg. It's terrible. It's a terrible tragedy, but that means there's a lot of other children who have anxiety, depression, trauma-related concerns. So, before the pandemic, suicide was the second leading cause of death among young adults, adolescents, and it was at historic rates. And then what's happened, unfortunately, during the pandemic, we've seen actual visits double. Our pediatric emergency rooms are overwhelmed right now with children. Hospital beds are not available. Providers are you're having a hard time figuring out how to respond. So unfortunately, it was worse before the pandemic than it had been, and now it's even worse. And so, really, that's why it's like Angelina was saying, and we've all said, we all have to come together on this. This is a real urgent matter where parents need to partner with their primary care folks and schools. Wayne was talking about with the school partners, and there are so many organizations across the Houston area working with schools, Legacy, some of the FQHCs. There's a lot of great providers out there, and we all basically are going to have to come together and to provide more, because it's kind of unprecedented what we're going through right now, unfortunately. Good news is these are eminently treatable. The vast majority of children are going to get better if they get care, but we need to get them care as quick as we can.
And I would add to that just recently, the American Academy of Pediatrics and the American Academy of Child and Adolescent Psychiatry and Children's Hospital all came together to declare that pandemic-related decline in child and adolescent mental health is a national emergency. So from all the different seats that they perceive this thing, they recognize kind of the trend we are. I know that just in the last year, emergency room visits for youth related to suicide attempts has gone up 30%. And I believe we're just seeing the tip of that iceberg, frankly. I know for most of us who work in mental health services, when school's not in, typically summertime and holidays, the number of children seeking services falls off because those supportive adults in their lives aren't there to say, hey, something's wrong, something's not right. And we've had now almost 18 months of that, where some of these youth haven't had that regular contact. And as we're transitioning them back in, they've been, this school year is a couple of months underway now. I think we're beginning to see that rising tide. And I worry about what's behind that that's still to come that we may not have fully seen yet as it evolves. And I think there's a tremendous need, and we're going to have to figure out how we rally to meet those needs, because frankly, there's not enough behavioral health providers in the system to do that. Even if we had all the money in the world, there's probably not enough clinical folks to bring together to try and individually meet those needs. So we're going to have to think about collective responses to that and community approaches to being able to meet some of those needs.
Thanks, Wayne. Angelina, anything to add here?
Well, because most of our services is done by peer-led, it's not handled by physicians. The one thing I can say with our warm line here in our offices, we have an uptick of calls from people who have never been on the radar for a diagnosis. They've never, and honestly, they're not really looking for a diagnosis. However, they are struggling with their mental and emotional stability, and they're looking for answers, where to go, where to get support, and they're not sure exactly what type of doctor to go to. So Wayne was right on the money with, start with your primary care physician. They do have a lot of recommendations of where you can get started in trying to stabilize your own mental health care.
I have one that might be a follow-up for that. Somebody asked, how can I find a mental health provider in my network?
We do a lot of that work. I mean, just because we have this warm line that, we have information and referral specialists that will sit on the line. The first point of action is they will try to help you navigate your own system. But as you know, when people are stressed out, they just don't want to read they don't want to call one more number. They don't want to read one more brochure. And so in those cases, we will try to facilitate more hand over hand, them finding the appropriate physician within their network to support them.
And I would say just, particularly for children, there's more resources than ever if you go to your family doctor. I mean, go to your family doctor and ask them. And there's a thing called the Child Psychiatry Access Network, which the state has stood up with all of our medical schools, a lot of our local mental health authorities, including the Harris Center, partnering in that too. And what they can do is they can both help your primary care doctor figure out what do you need, because maybe that you can just deal with it with just going to your regular doctor. Maybe you don't need to go to a therapist. But if you do need to go to a therapist, there's folks who can kind of try to find the right referrals in your community and help you with that. And they will kind of stick with it until you find somebody. So for children and adolescents, that's a fantastic resource. And it's probably the right thing for any of us. I mean, and if your doctor can't help, a lot of times you got to be pushy. I mean, like you have back problems. Sometimes they say, well, it's just in your head. It's like, you got to push sometimes. So I think take an advocate with you and have somebody with you to kind of buck you up. And, like what Angelina was saying, NAMI's great at that. I mean, peer support, whatnot. So I think that those would be my recommendations.
And if I can just add a thought to that, because the majority of the individuals we serve do have limited resources and often aren't insured, don't have resources to be able to pay. And so for those individuals, if they reach out to us, at 713-970-7000. That's our access to our crisis line, but it doesn't have to be a crisis per se. We can provide support services and help people without resources, either access care through our system or any number of other nonprofit providers that do care on a sliding scale or limited cost basis. So certainly it is not an easy task to get care if you have insurance, because there is a whole lot of hoops to jump through. But for those who don't have that, that's an even bigger challenge sometimes.
Yeah, Wayne, thanks. I think that's an excellent point. And it's good for everyone to have that number and to know this incredible resources available in our community. And I think, Andy, what you were saying, and Angelina, what you were saying about for those who do have health insurance and have a healthcare plan, to think about mental health as part of your healthcare and to treat it like, you have a back problem, you have other challenges, and really kind of removing some of that stigma to say this is something, and going to your primary care physician or your family doctor and making it part of your overall health plan is an important and I think useful way to think about getting access to these services. Erin, do you have another one?
I do. So Bijan N asked, how can we as a community support ongoing or new research to address mental health?
Participate in the research trials. One of the things we talk about often is how in the minority communities, some of the protocols for treatment, the medications, they're not for us. They don't represent, the minority population and how the medications might be metabolized, or, I'm not going to get into the specifics of it, but I will say this: there are opportunities through Baylor College of Medicine, UT Health, to participate in studies surrounding new treatments and new therapies. And it takes all of us to participate in those trials and those studies in order for the outcomes to reflect how they're going to impact such a diverse community. So I think one of the things we can do is, if we hear about some, and you can sign up, you can actually go to some of these research hospitals and say, I'm interested. And if you have a particular area of interest, participate in the studies.
It's a great point. It's a great point.
And I would say, I'm not going to say right your congresswoman because she's here, so she's listening. But at the state level, one thing that was done with our state representatives is about 6 years ago, we put in a thing called the Cancer Prevention Research Institute of Texas, CPRIT, which put over $1 billion a year into research into cancer cures here in Texas. That's why MD Anderson, other folks across the state are world leading. We need to do the same thing for mental health. And there's a start. We have about $10 million a year the legislature puts into this child mental health consortium. But, Texas still only gets about 3% of NIMH research funding for mental health and substance use disorder treatment. Last time I checked, we're about 10% of the country. So we really need to beef up our infrastructure so we can be more competitive and get more of those grants. So, and I love what Angelina said too. We have to have folks participate, and we need inclusive participation. And I think the institutions, Baylor, UT Houston, University of Houston, we have excellent schools here who are doing great research, social work schools as well, not just our medical schools, psychology schools. So, but we do need to kind of beef up our infrastructure. So let your state representative know you care about that.
Thank you, guys. So one question we have from Angela O. I'm wondering what effect social media may be having on young adults. Do any of you have thoughts on what parents can do as our children become more active on social media?
That's a hard one. So I'll share. So here's the thing. I mean, 2 years ago, I gave a different answer on this. And so the answer I gave 2 years ago is still somewhat true. I mean, at the end of the day, social media in some ways it can be good and bad. You can get social support through social media. You can reach out to networks of folks and get support through them. But unfortunately, what we've seen is there's this sort of polarization, kind of pushing people to like worry more. We're seeing a lot of negative impacts on folks. So I think we really need to, as parents, we need to we need to control it. And so, they're your children, and the devices your children have are your devices too. So, making sure that those devices are downstairs at night. They're not in the bedroom. They're not with that child. What we think about bullying, like when I was a kid, bullying was pretty bad, but like when you went home, it was over. I mean, the bully didn't follow you home. Now the bullies follow you home. And so you really have to take charge of that device. And, yeah, it's your child's, but it's yours too. And you got to put some limits on that. And I think the other thing is focus on the other parts of life that, it's not just saying, no, don't use your, stay off of social media. It's like, get outside, do things, exercise, let's do things as a family. Let's do things together. And, or if you are a working parent, you're not there, and it's hard for you to be able to do that. Church, faith-based organizations, other humans in your life, so you can we need to get more humans in to kind of counterbalance the devices, would be the things I would say.
I do want to add one thing to that, Congresswoman. You're right on the spot, but being a parent and recognizing that it's an uphill battle, and it's not just the children. I'm not going to say any more on that. And so what I do is I just try to outsmart the social media. I plan camping trips. As a matter of fact, the day after Thanksgiving, I'm looking for a hotel in the area where the antenna strength is very, very weak. And so I just continue to plan events around family where, gosh, I did not know that the phone was not going to work in this part of Texas. And so, or just like, Andy said, find activities and things you can do. When you said bullying, I almost thought you said bowling. You can't really do much with a cell phone in a bowling alley because your hands got to go into the bowling ball. So just find different things that you can do and outsmart the social media, because what children and adults really want and what they really need is connection.
I think that's it's such a great point. I too thought when Annie said bullying the first time, and so we're thinking alike. But I do think it's important that part of what these social networks offer us, and we talk about this on our Energy and Commerce Committee, where we have oversight of a lot of these issues, is people crave connection, and you can get a connection through social media, but you want to have healthy connections through social media. And so how can parents help their children make healthy connections, and how can we continue to have human connections so that they complement each other, instead of having only one, or feeling that you can't get it in those places. But I do think that this pandemic has really challenged all of us, and certainly whether it's our elderly parents, who we were worried about getting the virus and were much more isolated, or kids who are home and doing school from home and not able to see their friends and do all of those just natural things that you do as you're maturing and developing and connecting with other people your age, and becoming who you're going to become. I think that those challenges are really in front of us because of this pandemic, and because of the isolation that we've seen in so many different ways. And so I think just bringing back that focus to, it's important to have human connection. It's important to have connections to others, and how do we make sure that they're healthy? And so I think, Andy, what you were talking about, and putting some guardrails on those things to make sure that there's sort of healthy habits around it, and also healthy substance is really important too. And I think those are some huge challenges in front of us that certainly folks in Congress are talking about. As you said, there aren't easy answers. But I think it's really important to be paying attention to it, because asking the questions and caring about making sure that this is a healthy place to be is a huge step just identifying the potential risks and figuring out strategies, like you were saying, to avoid them.
We have a question, a specific question here from Andy. I have a family member who has a substance abuse issue, and I'm worried about the holidays being a trigger. What are some strategies I can think about to create a safe space for him?
I recommend co-planning. The minute, recognizing that there's a problem is the first step in, mediating that problem. And so I understand if you're being a support to that person, of course, you have to watch what's on television again, go to movies, stay away from commercials on Netflix or something in your home. And then, of course, make sure the varieties that it's being served, kind of steers clear of anything that would be tempting. I don't know what the addiction is, but I will say that whatever the practices that are adopted as a replacement for some of the old habits, or even the tactics that are adopted to divert that person's attention when they get a certain craving or a certain itch to be around a certain group of people or to practice certain bad habits, then it's best to get in partnership with that person and identify for them what is going to work and what is not going to work. Because in your best efforts, you could really trigger the person by not picking the right type of intervention.
And I'll add, just in the spirit of transparency, I'm a person on long-term recovery, and so I've got a little bit of insight probably in this deal. And I will say that I think Angelina's right on. Having a conversation is a tremendous help, right? If somebody had diabetes, we wouldn't go around and try and figure out how we're going to support them in the background, right? We'd call them up and say, hey, what do I need to plan for food? Like, how can I support you? If things aren't going well, is there some way that you can come to me? How do we get you to a meeting if you want to go to a 12-step meeting? If things don't go well, and sometimes holidays are kind of fraught with stress and conflict even at times. And so if that happens, how can I support you through that? How can I be there for you? And I think those transparent, open conversations really go a long way, related to substance use disorders, but as well, frankly, almost anything, right? From a mental health perspective, from family conflict, from managing stress to overeating, whatever it might be, that these stressful events kind of bring on. I think having an open dialogue, that voice and willingness and offer of support is pretty impactful to most people, right? And so them knowing that you're thinking about them and caring about them and trying to help them come up with plans to be successful through the holidays will probably mean a lot to that person and be really appreciated.
So I just add that that's the advice that Wayne and Angelina gave is great. We also have a site called okaytosay.org. I'll put it up. We have tips on there on how to have hard conversations with people. You basically, as a supporter, someone who wants to help someone. And like Wayne said, it doesn't matter what you're helping the person with, whether it's substance use, food. It's hard sometimes. And so to help you with that, I'll put that up, and you can kind of check out some of those tips there as for how to have those conversations.
That's great. Thank you so much. And I do think, it touches on this issue that I kind of raised at the beginning, but I'm interested. I know we're going to wrap up in a few minutes, but sort of having this conversation, Wayne, like you said, really to minimize the stigma, right? To tell people that you're there and you care about their success and you want to be a partner in their success. Also, I think it seems like it eliminates some of the stigma and some of the concern that people might be thinking something that they're not willing to tell you, for folks. And I think that it really is important, again, to think about this in the same way you would, as you said, think about somebody who has diabetes, saying, what can I put on the Thanksgiving table that's going to be good for you? What can I do that's helpful to you? And so I don't know if any of y'all can kind of touch on any other strategies that you think are particularly useful in addressing some of the stigma around mental health.
Well, the site I put up, actually, Congressman, was exactly for that. And I think talking about our own struggles. Like, I have an anxiety disorder. I've had an anxiety disorder since I came out of the womb. And it took 26 years before I got help with it. And I think, being able to speak and openly, it's huge. I mean, it's a really big deal. And I think the other thing we can do too is get over some of the myths. Like, I mean, I can't, people, and think about, I really like what Wayne was saying. Think about it like you would with anything else. So, like, I have people say, well, my cousin is talking about suicide. Should I talk to him? I'm like, yeah, you should talk to him. I mean, it's like if they said they had like a large growth coming out of their neck, I mean, would you talk to them? I mean, you say go to the doctor, you would help them. So I think you're not going to make it worse by helping them, by talking about it. There's no contagion effect to talking to somebody. You're not going to get the illness. You're not going to make it worse for them. Take their hand, help them go get that help. And I think the last thing I would say too is we have to talk about getting better, about recovery, because, you know, what was it that helped with cancer? You know, it was when we got better treatments, and we have really good treatments for mental health. I don't know why we don't talk about them. I think part of it is we make it so hard to access them. We wait so long to get people care. So we have to point out that most people, the vast majority of people with depression, the vast majority of people with anxiety, more than half of people with the most severe disorders get better. And so I think that's a big thing for giving people the hope to kind of reach out, because if they think they're going to get better, then they're going to be more likely to reach out.
Wonderful. So we are just coming up on the end of our time, almost. So I'll do one last question, and then, you know, feel free to sort of take it from there. But Congresswoman, what do I know? What do I do if I know someone who's in a crisis? Who can I call to help them without endangering them? And what are resources I should look to?
I say number one, you got to define the crisis, right? So our local county, you know, Harris County, City of Houston, we have a wonderful crisis intervention system. If a person is in danger of harming themselves or in danger of harming others, of course, you can call the Harris Center, that 713-970-7000 number. And there are a number, you can call 911 and say this is a mental health crisis, and they will do their best to have a special CIT team address that particular call. The issue turns, though, when it's a crisis for you and not a crisis for that system. That's what you have to prepare for. And what we share with our families is it's not if a crisis is going to arise, it's when the crisis arises, are you prepared? And so sitting down and just thinking, what would you do if you had a Christmas party on Christmas Day and a family walked in and was having auditory or visual hallucinations? What would you do, right? They're not really a threat to anyone, but they're afraid. Not only are they afraid, but you're afraid. Who are you going to call? Where are you going to go? And write down the prescription for your own family, for your own team. How do I manage this? Where do I go? Who do I talk to? And I can tell you that was an actual scenario for me. It was Christmas Day. And I emailed the entire Coalition of Behavioral Health Services, and some wonderful people emailed me back. And the organization that I was able to get help on Christmas Day, where I could actually put the family in my member in my car and drive, was the Council on Recovery. Who knew? I'm not saying that's the same in 2021 and 2022. That was several years ago. But have some step-by-step process. Put a plan in place earlier. If you need help putting together a plan, of course, you can call our warm line. But, you know, just remember that a crisis to one is not a crisis to all. So whatever your situation, have a plan in place on what you're going to do to get active when something presents itself, whether it's a family member or a stranger.
That's great insight. Thanks, Angelina. Wayne or Andy?
Yeah, I'll just add there, Angelina referenced, there are a lot of crisis response options in our community. We have a broad kind of array of them. If it's an immediate kind of life-threatening suicide concerns, that sort of thing, harming themselves or others, 911 is often the best first call. And there are a lot of really well-trained officers who've been through mental health training and respond with empathy and compassion. We do have teams of co-responders where our mental health crisis clinicians are dispatched along in the same car with law enforcement. We have virtual response options in some parts of the community where they have tablets and can connect to our crisis counselors virtually, so we can provide crisis assessments. We also, Angelina, I appreciated the little promotion there of the crisis line. I dropped it into the chat function as well. That our crisis counselors are there 24/7. They can help provide that response. They can also dispatch our mobile crisis outreach team. So we have people who don't have to involve law enforcement, can go out to people's homes when they're in crisis, and begin to provide support there in the community with the goal of helping that person remain in the community if that's possible. So there's lots of options. I also dropped in the chat line our text support line. Some people prefer text as opposed to calling these days, right? So there's also that option for people to get help if something is going on and they don't know quite where to turn.
Congressman, if I could just add, so Angelina and Wayne covered it. I mean, the supports they are great, but I think the other thing is, let's not wait till there's a crisis. We wait 8 to 10 years now before we give people treatment for their symptoms. So 8 to 10 years go by when we could have been doing something. And so the kind of supports that you asked us actually to talk about earlier, which are some of these telesupports, it's a great way to make sure we get access to people. And I think one that is often underrepresented but is super useful is audio only. You know, we're trying to get more broadband to people and we're making great progress. And that's another place where, you know, thank you, Congress and Congresswoman, for making more resources available. But it's going to take a while. And also sometimes, I don't know if you all found this, but I kind of like it when our videos are off. Like, I kind of like it when it's voice only. And so that works really well for a lot of treatment options. So whether it's text, like Wayne was talking about, tablets, phone, the thing y'all are doing in the health committee your committee. I get everybody's putting back up.
The health subcommittee, you're right. Health subcommittee on energy and commerce.
Yeah, exactly. We do need to try to level the playing field there because these things work. May not work so well for surgery to do that stuff over the phone, but it works super well for mental health.
That's great. Well, and look, that makes a ton of sense. I really appreciate y'all sharing all those numbers and resources. And I think what we will do is send a follow-up with the information that you've put in the chat to the folks who are participating and for the folks who wanted to participate but told us they couldn't participate live, who will be able to watch this in perpetuity. We're going to make it available for people to watch this conversation, because as we approach the holidays, as we process so many of the things that, you know, many people have just been forging through over the last 20 months and more, you know, people are really appreciative of opening up this conversation, opening up this dialogue. And I know that those who have come to you understand and know what an incredibly valuable service each of you provides and your organizations provide. But not everybody knows, and that's part of our goal, is to help get the word out. And so I'm really grateful to you for the opportunity tonight to hear from you. All three of you are so approachable and accessible and thoughtful, and I want to stay on Zoom for another hour just listening to you talk about these issues, because it really is, it makes it something that you want to engage on and that you want to help. And I think that that's one of the privileges for all of us of the jobs that we have, that we're here to help people and we want to help people. And so, you know, as we wrap up, I'll turn to you for any closing thoughts, but I will just say we'll take the information you shared, the phone numbers, website links, we'll circulate that. And of course, while we can't do exactly the same things, my team and my office and I are always here to help as well. And so we'll circulate our contact information again for folks that can reach out. And sometimes what we can do is legislative help and working on bills or voting for good legislation. And also some things we can do are help people connect with people and organizations in our community that are really going to make a difference in their lives, and help connect people with federal agencies that can help. You know, some of the things that are so incredibly frustrating are things that we can actually help with getting through to some of these federal agencies, getting access to your Social Security or your Medicare benefits so that you can have access to these things, accessing your veterans benefits, anything with a federal agency. I'm always glad and really proud to be able to help our constituents with. So we'll circulate all that information to everyone. But I would love to turn the floor back to the three of you for your any closing thoughts you want to share for a minute or two here before we wrap up.
Well, I will just close by saying that nothing is going to replace education. If this is on your radar, if this is your issue, if mental health is something that you want to be an advocate for, you got to get educated. And NAMI can help you do that. Again, we're not the end all, and we're not the only answer to every issue, but we have a lot of partners and a lot of resources that we can help undergird whatever your efforts are, whether they be, education, supporting, volunteering with families and children children, or even being an advocate and partnering with you, Congresswoman, we will help direct you to the right spot. Thank you for inviting me again.
Thanks so much, Angelina.
Well, it's hard to add much to what Angelina said, and I'll let Wayne have the last word, but I'll just quickly say, if you're trying to figure out an answer for something we didn't talk about tonight, a good shorthand is pretend like it's another type of health concern and say, what would you do for that? Like, to pretend like what I've been telling people to do is actually pretend like your brain is actually part of your body. And if you do that, what would you do? What would you do differently? Well, you would go to the doctor, you would help the person. So I think a lot of times we're hesitant, and we know what the right answers are. We just, for some reason, don't want to do them for these disorders. So pretend like your brain is in your body.
It's terrific. Thank you. Wayne, last
Yeah.
word for you?
Yeah, absolutely. And I'm going to echo something that Andy said a couple of minutes ago, which may be the line of the night for me, which is don't wait till there's a crisis, right? These resources are here. It may take a little bit of legwork to get to them. We've tried to make it easy by sharing the information, but there are a lot of options to get support and help, and don't feel like you've got to struggle through this alone or that you're the only one going through it. So if you reach out, no matter which path you take to reach out, do so, and we'll be happy to help get you connected to support.
Absolutely.
Wayne, that's a great way to close out the evening. And I think that we couldn't have a better example of people who care about and are committed to the people in our community than the three of you who were here tonight. So I'm grateful for your time and your insights, and hope that we will continue this conversation in all the ways we can help address these issues in our community. So thank you all so much.
Thank you.
Thank you.
I'll take care.